Often referred to as the body's fuel pump, the human heart is responsible for supplying oxygen-rich blood to every organ, keeping us alive and functioning. But when the valves inside the heart don't open properly or when they leak, the outcome can be grim. Known as heart valve disease, this common condition is already in moderate or severe stages in about 8 million Americans. While the disease increases in severity with age, New York cardiologist and president of the Heart Valve Society of America, Jeffrey Borer, explains that if heart valve disease is caught early, it can be treated before it's too late.
The primary consequences of heart valve disease are lack of capacity to exercise maximally. People become short of breath. When they exercise, they may develop chest pain called angina. They may faint. If symptoms develop, in many instances, the disease has progressed so far that the heart muscle is already severely and irreversibly damaged. We can prevent further damage by surgery or other invasive procedures, but our goal really is to find people who have heart valve disease early, when we can still intervene and prevent any permanent damage.
So how can valve disease be caught early? Careful physical examinations, aided by certain tests, can uncover even very elusive signs. Dr. Borer admits valve disease is not always easy to recognize, which is why he encourages healthcare professionals to learn more about what to look out for when examining patients.
If heart valve disease is present in family members, depending upon the kind of heart valve disease that was found, it could be very important to screen other family members, and particularly children, so they can be followed. That involves taking more time, which involves looking at the veins in the neck, or feeling the pulsation of the arteries in the neck, or feeling the heartbeat against the chest wall, which really is best done with the patient lying on his or her left side in what we call the left lateral decubitus position. That's very important. If the physical examination suggests the presence of valve disease, it's often useful to perform objective imaging tests to determine precisely the severity and importance of the disease to the patient.
My wife had indicated, and I thought too, that I had problems with my heart. I was, for instance, sleeping longer hours, going to bed earlier. I was doing housework, household chores like mowing the lawn and things like that, and I was getting fatigued. Dr. Borer decided to have my aortic valve replaced, and that was done in 1996. And that was a terrific improvement for me, because over the next year, I was gradually feeling better and better until now, which is, I'm after 17 years, I feel very good as far as my heart goes.
Rene Supino is one of the lucky ones. His diagnosis came early enough to save and prolong his life for years to come. It's Dr. Borer's life's work to help save more people's lives. Despite the fact that heart valve disease is a serious health issue, it had received little attention. Dr. Borer and other top colleagues in the field banded together and created the Heart Valve Society of America, a medical community devoted to heightening awareness about the disease.
The mission of the Heart Valve Society of America is to foster research so that we can better identify and treat people with heart valve disease, to foster education within the profession so that more doctors are better and better aware of the problems associated with heart valve disease and the way to identify and treat the disease, and finally to educate the public so that they can seek attention at a time when treatment for valve disease is going to be best suited to prevent adverse outcomes.
The Society is an informational resource for everyone and covers issues from important research initiatives to the latest treatment options.
Valve surgery, or mechanical interventions as we call them, are available for most people who have valve disease. The risks associated with these interventions have diminished dramatically since they were first introduced more than 50 years ago. So there's a constant effort to improve the quality of the material that we use to replace valves. Cardiologists today are very enthusiastic about the information provided by the Heart Valve Society of America. We're in the process of merging with our sister organization in Europe, the Society for Heart Valve Disease, so that we can have a worldwide network to educate patients, to educate doctors, and to perform research to better deal with the problems associated with heart valve disease.
To learn more about heart valve disease, visit heartvalvesocietyofamerica.org or email us with your questions.